Hi everyone, this is Mikala Monson. For my project in oral pathology, I am going to explain what is necrotizing ulcerative gingivitis, which is NUG. Included on my presentation are the description of the disease, diagnosis, and treatment. First, what is gingivitis? It is an inflammation of the gingival tissue. This is the most common disease that is easiest to control and treat. There are different types and stages of gingivitis, and one example is NUG, which is necrotizing ulcerative gingivitis. What is NUG? It is a disease that has been described over centuries and is characterized by a rapid onset of pain and development of necrotic ulcerative lesion of the gingiva. Back in World War I, in 1941, trenches were made for the front-line soldiers to protect themselves from the enemy. Life in the trench is a very stressful and unhygienic place to live, but this is the only way for the soldiers to be safe. There are a few names that is associated with NUG, such as trench mouth, Vincent's disease, or Vincent's stomatitis. Historically, NUG is related to stress and is widespread among soldiers in the trench, hence the name trench mouth. The diagnosis for NUG is based on clinical examination, but it has a signs and symptoms as well. Here are the signs of NUG. The gingiva shows that it has a punched-out gingival margins, pseudomembrane coating. It shows redness, bleeding may occur, and it can be localized or generalized. The microorganism that's involved is fusiform bacteria and Prevotella intermediate. Symptoms: Patient may experience intense oral pain. It has a strong odor. Occasionally, patient may develop a fever. NUG is also common on young adults, ages 18 to 30 years old. More signs and symptoms. Patient should avoid eating spicy or hot food. This may lead to more discomfort to patient. Patient will also have metallic taste and excessive amount of pasty saliva. Here are the other predisposing factors of NUG. It is stress-related, poor diet, poor oral hygiene, if a patient is a smoker, and NUG is also present on patient with HIV positive. I wonder if there's any treatment for NUG. There is a treatment for NUG. Patient must have periodontal treatment done, rinse with chlorhexidine. Doctors can prescribe antibiotic and pain medication. The dental hygiene can also counsel their patient with proper home care and smoking cessation. Follow-up treatment is needed. Second treatment should be follow-up in 1 to 2 days to check if another debridement is needed. Third visit is recommended in 3 to 5 days. This disease leaves a cratered papilla and surgical correction might be needed. There are a few differential diagnoses of NUG. 1. Primary herpetic gingivostomatitis. Second, desquamative gingivitis. Third, ascorbic acid deficiency, which is also known vitamin C deficiency. What will happen if NUG is left untreated? NUG can become chronic and recurrent, and in very rare cases can lead to rapid destruction of the tissue and bone. Now it's called necrotizing ulcerative periodontitis, which is NUG. Here are my references. In summary, taking care of your oral health is very necessary. I hope this presentation helped you as much as it helped me to understand a little bit more about necrotizing ulcerative gingivitis. Again, this is Mikala Monson saying thank you for your time.